Okay, very good morning to everyone. So today our topic, a very interesting topic, okay, type of breast issues and solution with Ganotherapy. Currently, breast cancer is one of the, it's not only breast cancer, breast issues, we got so many type of breast issues. What you call cyst, fibroid, cyst, a lump, and also a cancerous cells. So there are a few types that we need to know. It's a very important topic for the ladies to know, and also think about guys. Guys, you don't think that only girls have the breast issues. Guys also have the breast issues. Okay, in US, quite a number of guys has been operated because of the breast tumor. Okay, so we go on. First of all, we'll see what type of the breast issues that currently in the world that women are suffering. Okay, women are suffering. Actually, the suffering from the woman is highest. Second is the men. Okay. Okay. When you see the breast pathology, we can see three type of conditions. Okay, three type of conditions. The first condition is inflammatory conditions. Mostly the inflammatory condition happen for mastitis, mammary duct ataxia, and fat necrosis. And the second one is a benign conditions, fibrocystic change, intraductal papilloma, fibroadenoma, pylorus tumor. Okay? And the third one is malignant condition. Okay, ductal carcinoma in situ, invasive ductal carcinoma, lobular carcinoma in situ, and invasive lobular carcinoma. So these are the major of the conditions that have in the breast pathology. Okay. When you go down to what you call, when you find out something is wrong in the breast area and you worried, you go down to the hospital, the doctor will check you and you will start to do some analysis. From there, they will come out with what are the next steps need to be done. Okay, from there, we can see a few types of condition has been placed out where you are in that category. Once they place you which category you are, then that category type of testing has been done. Sometimes they will do like biopsy. Sometimes they do the what you call X-ray. Sometimes they send you to this PET scan. It depends on the category, where you are, and what are the severity that you are in the category. Okay. So the next one. Okay, the first we will discuss on the inflammatory conditions: fat necrosis, mastitis, mammary duct ataxia. There's a three type of inflammatory condition. This condition, the first thing you can see a lot of pains, and also you will have unconditional, your uncomfortable things will happen to you. You feel very uncomfortable. Okay. Okay. Breast fat necrosis is a small. You see the breast side here. There's a small white color patch. Actually, that's kind of a patch happen. Causes by breast blunt trauma. There will be small kind of necrosis, fat. They call it fat necrosis. When you do a physical exam, you will see it was very painless, no pain at all. Painless, very pain. When you press it, when you search on yourself, when you press it, you got the pain. But most of the time, you don't have the pain at all. Okay, and it like irregular mass. That small mass is very small. Okay, it's associated with echomyosis and retractable. Sometimes the nipple has been retracted. Okay, nipple has been retracted. So this is the breast fat necrosis. You will feel some painless, but you will see some kind of inflammatory solutions, inflammatory. Okay, and you see here. Fat necrosis of the breast, okay, it's referred to non-viable dead adipose tissue. So mostly it's a dead tissue replaced by scar tissue. Okay, it's a multinucleated giant cell with calcification, sometimes a calcification, most commonly associated with mechanical trauma or recent breast surgery. So previously, if you've done a surgery, then in that area you can see small dead tissue that not been out from that area. Okay, so this is very basic and nothing to be worried about it. The next one is mastitis. Okay, it usually occurs for breastfeeding mother. Sometimes when the mother don't have enough milk to supply to the baby, insufficient milk drainage. So when the baby pressure too much, the whole area of the nipple and the breast area become inflamed. Okay, so they will have a very stiffness kind of things. It's very painful. And this because of the milk condition is very low. Okay, mostly happen to the breastfeeding mothers. And that's why breastfeeding mother need to eat a lot of good food, okay, nutritional food to make the milk production increased. If they don't eat properly, if this mother, they keep on, nowadays mothers, they keep on more fast food rather than the real food. Huh? Okay, so that is also causing this kind of problems on the long term. Okay, so they are unable to feed the baby. They are unable to feed the baby. So what this condition is like inflammation of the breast area. Okay, and to solve this, nothing to be worried on this category. Okay, and the mother can continue breastfeed the baby. They can put a warm cloth on top of it, can apply like Gano oil, small basic oil to like a slow massage, or they can put some hot towel. Okay, before sleep, before feeding, before breastfeed, they can put a hot towel for a while. Then they start to breastfeed, and mother need to eat more nutritious food. Okay, more nutrition food. That food that can improve the milk production in the mother's body. Okay, so these are the things. It's not very dangerous, but you need to know about that. Then at least you don't worry when the conditions appear. Okay. Okay, and this one is a mammary duct ectasia. Okay, it's known as a mammary duct ectasia. It's a benign, non-cancerous. Actually, it's the condition when the breast widens and its wall is thickened. The duct, the milk duct in the breast become widened and wall thickened. This is also happened because of this. Just now we go through, is it the inflammations due to not enough milk. Okay, sometimes the milk production blocked, okay, hardened inside the lobule in the milk duct. So when it blocked or the baby too much when they're breastfeeding, also this time also that it can happen. Or ladies that already going to menopause category, getting close to menopause category, you will have a menopause syndrome. The menopause syndrome also can create this kind of a problem. Most of the ladies that getting near to the menopause category. So they have, like previously, maybe they don't give, they have what you call hard to breathing, hard to give baby breastfeeding, and the very less milk then is blocked. So they just leave it. After a while, the milk has been blocked inside, or they will become long-term blocked, and they didn't understand that. And but when getting aging, because the pre-menopause symptom, the hormonal changes happen, and they start to have the pain in the mammary duct. Okay, mostly these kind of things, when you go hospital, they give you some antibiotics, all these things. Mostly they can clear, and sometimes there will be discharge like a thick cream out from the nipple area. So when they know that, then they can. The best is you can apply a Gano oil and massage every day. Then give a little bit pressure to remove all the discharge out from the breast area. Okay, so nothing to worry on this portion, but they just need a precaution, just follow up. Can apply VCO, virgin coconut oil, can apply Gano oil.
And they should come in because this is the problem, but they don't.
Make hygiene, make sure the area is clean and not compressed with the what do you call, the bra that they use. The one all must be very soft type or whatever. So not compressed too much. That will end up with the clogged, dilated, and the clogged duct maybe can be bleeding later part. So they must be well known on this area, and they must make sure it's very clean and very relaxed. They must make the things very relaxed. Okay, and this kind of situation, sometimes when you pressure too much, it can release a lot of blood also sometimes. Okay, because that's a high pressure happen in the mammary duct. And they call it in the mammary duct. So it's a bleeding happen. So that is the second category really. Okay, but no need to worry unless the critical thing or the inflammation is completely percentage of the inflammation is very high, then we need to have precaution. But most of the cases, by applying warm cloth, okay, you just hot towel, you create a hot towel. Morning maybe you put for a while, then you apply Gano oil. Then night time before sleep, release the bra, then put the hot towel for a while. Then you can see slowly the thing will change. Then the inflammation go off, and this kind of discharge will disappear. I have a few cases like this. Then after we teach them to do what to do, then they follow accordingly. Then within few weeks to months, they completed. But when you go hospital, sometimes they give you some antibiotics. You can take that together, no problem, and also apply accordingly like what we are telling. Okay, then you can see very fast the changes happen. Okay, so okay, another one is OCP, breast tenderness. This is normally happen to ladies that taking oral contraceptive pills. See, these oral contraceptive pills is in a long term is not very good. Okay, and when you have diffuse breast tenderness, very painful suppression, compressed tenderness happen in the breast area, and this is due to women that always taking oral contraceptive pills. They don't want pregnant, so they take these kind of pills and end up with this kind of problem. So by stopping the oral contraceptive pills and maybe they can plan for IUD or other type of treatment, not the oral OCP, but not the OCP. So in this case also you can apply a Gano oil, warm cloth, and also can take some of the Ganotherapy things to make sure you feel more relaxed, and don't do a lot of compression bra. All these things will affect the area. Okay, for the first step or the inflammatory area, what we can what we can suggest for fat necrosis, mastitis, mammary duct ectasia. You can take mycoveg 1 scoop, Morinzi 20 ml, 1 scoop orichallium powder, 1 scoop roselle powder, mix warm water and drink 3 times daily. And apply Gano oil at the affected area 3 times daily, massage. And at the same time, you also can give a hot towel. Hot towel is a very powerful thing for this, for the first category, for the inflammatory. So clean hot towel, make sure don't inflame it, okay? Don't infect it. So take the clean towel, soak into a hot water, put a little bit of salt in the hot water, okay? So then you soak the cloth, white towel, a clean towel, then you just apply for a while. Then in the long run, you can see a lot of changes happen for this kind of a scenario. Okay, we go on for the next type. The next type is under the benign conditions, where we will see on the fibrocystic change, intraductal papilloma, fibroadenoma, and pylorus tumor. Okay, these are the second level category that we can call under the medium to severe category. If you never take care on this category, it might go to the severe category. Okay, breast abscess. Okay, the first one is a breast abscess. Breast abscess also can be affected due to bacterial infection with pus formation. Okay, you can see a pus formation. So in that area, you can see tender, warm, and singular round mass that is quite painful. And you can see a bit reddish color. It's a reddish color. So this breast ulcer mostly from infections. Sometimes when you first level, maybe they can give you some antibiotics, or in a Ganotherapy way, you can take Morinzi lot. By taking Morinzi and Androgy can solve this issue. And together with you want to get medicine from the hospital, some antibiotics also, it will help actually. Then need to be monitored. Need to be monitored closely, see where you are, how the changes happen to the abscess area. Okay, whether the abscess, the pus come out from the nipple, or it just like a outer layer. Mostly this is the outer layer. Outer layer. That means like a pimples. Okay, big pimples like this. Sometimes you see in the face got big pimples. So this abscess sometimes happen in the area of breast with a big type of pimple, like pimples in the face. So when you clean it, when you press it, it will break, and after that it will heal by itself. This kind of breast abscess, I have so many cases has been treated. Sometimes this abscess also happening because of infections. Sometimes they are not very hygiene. Okay, wearing too long of this brush, all these things without changing, and also too many sweating, all these kind of things also happen. Okay, the tenderness, the pressure has been given, stress, all these things can lead to this abscess or infections on the bra area, on the breast area. Okay, so that's why you need to very clean and make sure hygiene is very important for this category. Then you don't have this abscess happen to you all. Okay. The next case is a breast cyst. Okay. Breast cyst is normally a fluid collection behind clogged duct. Okay. When the duct has been clogged out, okay, they got few types. It can be clogged of water. They call it water cyst. Sometimes if the clog is water, when we do monitoring, we can see like water inside. Okay, so when your pressure is like the water balloon, like you take the balloon, you fill up the water in the balloon. When you pressure it, when you check on it, you will see that it's like fighting back. You see, like water, when the balloon you press back, it will fight back. Okay, so that is actually a water cyst. Okay, it's a cyst inside the fluid. Most of the cases, they will be do a drainage, fluid drainage. They just inject that area. They just pump it out, the fluid out. Okay. The second kind of cyst is actually what we call is a cholesterol, or some kinds of maybe some mineral deposits or cholesterol inside the blocked club. That is different category really. Okay, but most of the category is actually a normal cholesterol and a water fluid. Okay, so physical exam finding painless, singular round mass. If you see it for water, you can see it's like bouncing back. But if it clogged, if it like a cholesterol, you won't bounce it back, but you can see a solid mass inside that area. It's a round solid mass. So these are the two things you can see in this area breast cyst. But this is all need to be monitored. But if it not grow, so that means you need to monitor every week. Every week you just pressure that, you can check on that area. And internally, if you are taking a lot of fast food, all these things, this kind of mess can be created. Okay, it's also some kinds of a hormonal imbalance also this can create it. Taking a lot of the OCP, contraceptive pills, and other what we call family planning medicines also can cause this kind of cyst that can happen. Okay. Fibrocystic change, okay, refer to the benign fibrosis and cyst tissue formation usually occur to pre-menopause women, likely hormone mediated, different subtypes with varying degrees of risk of cancer. So we got apocrine metaplasia, we got sclerosing adenosis, atypical hyperplasia. So that means apocrine actually no risk, normal no risk. This has been seen by this is actually type of cells that you can see by what do you call by biopsy. Okay, when they take out certain fibrosis, they send to the lab, then the report come out actually if they say apocrine metaplasia, it's actually no risk lah. If you see in the report it's a sclerosing adenosine, there's a mild risk, or atypical is a high risk lah. This is based on the output from the what do you call from the biopsy cell that's sent to the lab lah. Okay, from there you can see mostly happen to premenopausal women. Okay, that's why women is they are very prone to this menopause. See, the changes of the hormone happen in the menopause. That's why in the menopause category, women have a lot of difficulty, and changes in the hormones has been happened very highly. Okay, very highly. Their hormone change, and they also mind, mental attitude, everything has been changing on the menopausal time. So they must understand and must be very relaxed. That's why when you come to aging or at the time of the menopause, you need to change your mind, mental, physical. Physically, you need to change. Maybe most of the people, they do yoga, they just fill up their time with a lot of activities, and they don't pressure too much, they sleep well, they eat a lot of greens, veggies. If they maintain a very good lifestyle, okay, the premenopausal symptom is it will be normal. Some people, some women are very stressed, very anger, lack of sleep, very pressurized. This will cause a lot of hormone changes happen into their body. When these things happen in their body, it will create a lot of problem in the long run. Okay, that's why when you getting older and older, the first thing you must remember, okay, sleep enough. Okay, your sleep must be 6 to 8 hours. The more you sleep, the rest you given to the body is playing a big role to your body. Okay, the first is your sleep. The second is your food. Increase more alkaline foods. Okay, increase more alkaline food. If possible, stop all the red meat and seafood. You can take a little bit of a fish or maybe a kampung chicken, okay, but no red meat at all and no fast food at all. Okay, remember, women that are already going near to the menopausal category, make sure your mind is really clear. Don't stress, because the stress is killing you actually. The stress will lead you towards a lot of issues in the long run. Okay. Okay, the other one is a breast fibroadenoma. Okay, unknown, but they might be related to reproductive hormones. In a modern conditions view, okay, in a modern medication view, actually the cause is say unknown. Okay, but they might relate to reproductive hormone, menopausal hormones. Okay, stress, sleep, food, everything play a big role in the conditions of the humans. Okay. Physical exam finding painless, mobile, singular, round and mass. Okay, painless, mobile mean it movable. Okay, when you press it go up, when you press it go down, it's movable. When this breast fibroadenoma move, when you see this kind of what you call lump, the fibrosis is movable, it's under category of fibroadenoma. Okay, it's really associated with menstrual cycle. That means your premenopausal category. Okay, your period categories. That means if your period, if your hormone imbalance, if your weight is too much, your stress level is very high, your sleeping imbalance, your food is imbalance, and this what you call the lump, the fibroadenoma can grow. Okay, if you relax, good sleep, take good food, avoid all this what you call junk food, okay, then the fibroadenoma won't grow. Okay, it can last long as it is. Okay, there are few cases we see when they change their lifestyles. the fibroadenoma never grow. It just stay there for 10 years, 15 years, the same size, never grow at all. But if there's lifestyle change, then these start to grow again. So when it grow, then you have a bigger problem. So we have to go to the step 3, okay? Whether it's a metastasis or what is the second related things will happen. Okay. Okay, the fibroadenoma, okay? Refer to the marble-like rubbery mobile, stromal glandular benign tumor, okay? Estrogen sensitive, will enlarge during pregnancy, menstrual cycle. Typically occurs 15 to 35 years old woman. Okay, this is the normally they will tell, but currently the age is not particular. A lot of people also have. Okay, so estrogen sensitive, menstrual cycle imbalanced. When you have a menstrual cycle imbalanced, fibroadenoma can grow. Okay, and you don't need to worry on that part, and we have to monitor accordingly. Okay, when we monitor accordingly whether it keep on growing or not, and every time you test yourself and make sure the things is not growing by itself. Okay, and by changing of your lifestyle, things will be better. Okay, things will be better. Okay, and another one is intraductal papilloma. Okay, bloody nipple discharge. Okay, when we press the nipple, it will have a blood start to come out. Okay, physical exam highly variable and often there's no finding. So some blood come out, then it stop. Okay, tomorrow you can see slightly blood come out. So it keep on coming out. So every time when it come out, it's like a new blood coming out. Okay, it also depends on the where is the block. Sometimes there is small cyst is blocked the nipple area, but when you press it, the what do you call the cyst of fibroid, the fibrosis, they can damage the wall of the duct. The wall of the duct. So when the wall of the duct has been wounded, then the blood come out. I have few cases of this intraductal papilloma. Actually, after we apply Gano oil with RG powder mixed with the Gano oil, and after a while it's disappear. Okay, because this is not a big issue, but you need to monitor. Okay, you need to monitor. If it stop, okay, good. If it keep on coming, then we have to go for the secondary level of treatment. Maybe we have to find, maybe have go and have the X-ray or whatever it is. Then we have to monitor accordingly. Then we will advise you what to do. Okay. Intraductal papilloma, okay, is refers to papillary growth within the epithelial cell of the large duct. Okay, bloody nipple discharge, premenopausal woman normally, fibrovascular projection lined by luminal myopathy. So this is by what you call this myoepithelial cell, or you do the pre-biopsy, you already know biopsy. From there you can get the report. Okay. And another one is the breast fibrocystic lesions. Just now you see the fibroadenoma, and when it keep on growing, it start to grow bigger. Okay, so this is the one is actually grow bigger. Fibrocystic, when you grow like bigger type of small. When it's small, it's fibroadenoma. But when you keep on start to grow, it's fibrocystic lesion. It's keep on growing. So the tenderness, increase in tenderness, increase the size of the breast, everything will be start to grow bigger. And this is no choice. You have to remove all because until before it attack the blood vessels or it start to damage the other organs. So this is very aggressive kind of things. Mildly tender, but multiple masses keep on growing and non-stop. Okay. That's why when come to the fibroadenoma, you must be very careful with it. So you must be very relaxed, changing of food, changing of all these things will help you. You won't go to the second stage for the fibrocystic lesion. The first will be fibroadenoma. Then if you don't take care, it start to grow like a cystic growth. Then this is too big really. Okay, sometimes have a bigger. There's no way you can come out. End of the day, if grow too big, there's no choice. You need to remove it as fast as possible. Okay, for this kind of solution like fibrocystic change, intraductal papilloma, fibroadenoma, pilloidis tumor, okay, need a close monitoring and follow up. So these are the things that you can take: micro-AG 1 scoop, Morin Z 20 ml, 2 scoops of Richelieu powder, 2 scoops roselle powder, mix warm water, drink 3 times daily, apply canola oil at the affected area 3 times daily, massage gently. So this will help you to reduce the problem or solve the problem, or if it not solved, then we have to combine treatment with the modern medication system. Okay, by combining holistic and modern medication system, we can see a lot of improvement. Okay, so that's why sometimes we have to go first level. If we cannot, then we have to go second level. Cannot also, then we start to combine integrated level. So when you come to integrated level, maybe surgery is needed and continuous continuous with Ganotherapy and with the modern medicine doctors' ideas lah, whether they want to give chemo 1 time, 2 times or whatever, or need a surgery or anything that they realize lah, they advise accordingly. So we will advise both together, and we make sure the patient is recovered as fast as possible. Okay, so this is the second part of the problem or issues. Okay, now we go to the third part. Okay, the third part is the malignant conditions, whether ductal carcinoma in situ, invasive ductal carcinoma. So ductal carcinoma is the first level. When the thing is keep on growing bigger and it becomes invasive, then they call it invasive ductal carcinoma. Okay, this is the duct of the breast. And second one is a lobule of the breast. So lobular carcinoma in situ is the small lobular blockages. But when it comes to invasive, the whole lobule has been blocked out. Okay, blocked, and it will appear and start to move towards the other area, so other lobe. So that is called invasive lobular carcinoma. Okay, so you can see the 2 part here. Okay, the 2 part here that okay, so ductal carcinoma is the first, the round box I put here. Okay, a typical ductal hyperplasia. Okay, ductal carcinoma in situ, whether the ductal, okay, you see the duct. Okay, the duct is the pipeline. The pipeline is called a ductal. The flower type of the things, they call it lobule. Okay, lobule. So when the duct has been partially start to block, they call it under the ductal carcinoma in situ. But when the ductal is almost completely blocked, it called invasive. Okay, it called invasive. So these are the 2 things. Okay, it's a both, but one is the base starting, and another one is invasive, become worse. When it works, we call it invasive ductal carcinoma. Whether it happens in the ductal area, that's why they call it ductal carcinoma in situ. They call it DCIS, or they call it LCIS. They call it invasive IDC. Okay, for invasive lah. Okay, another one, the other type is actually lobular carcinoma. Okay, lobular carcinoma. Okay, the lobular carcinoma is actually the lobule. You see the flower type. So there's a duct coming to the lobule. So the lobule actually the milk area where the storage of the milk has been developed. Okay, so then it use the duct to travel into the nipple. So when the lobular carcinoma, when you call lobular carcinoma in situ, means that the lobule has been the cells has been blocked. Okay, the lobule has been blocked with the cells. Okay, and it start to grow in and block the cells. When overall lobule has been blocked, they call it invasive lobular carcinoma. Okay, so if partial LCIS, okay, lobular carcinoma in situ, the starting of the cancer cells inside the lobule. But when it fully covered and start to attack other things, we call it under the invasive carcinoma in situ. Okay, so these are the 2 things that we need to know. It's both is malignant and very dangerous in the long run, and we have to take immediate solution and solve it as fast as possible. With a combination treatment, I see it's not a big problem with Ganotherapy and the modern medication. We have treated quite a number of people, and we can see the chances of recovery is very, very high. And for these kind of cases, what we can see, ductal carcinoma in situ or lobular carcinoma in situ, DCIS or LCIS or invasive. Okay, need close monitoring and follow-up. Okay, integrated medicine is highly recommended in this stage. Okay, highly recommended in this stage. But in the ganotherapy part, what we can do, we can mix with the myco-veg, Morinzi, 330 ml. Morinzi we increase as much as possible. The more Morinzi they drink, the more better they are, more recovery they are. And 2 scoop with Mytavita powder, 1 scoop gel powder, 2 scoop of roselle powder, 20 ml Fruzin, mix warm water, drink 3 times daily. Or mix in a 400 ml water, drink 3 bottles per day. Morning 1 bottle, evening 1 bottle, and night 1 bottle. That means they can take up to 8 to 12, 12 to 4, 4 to 8. Every 4 hours, 1 bottle of drink, start 8 o'clock and ending 8 o'clock. So they can start to do that. When they start to do that, there are plenty amount of all these things when enter the body start to become an alkalining agent. We are supplying the alkalining agent to the body. And Andro-G, 2 capsules 3 times daily, and black cumin 2 capsules 3 times daily. And Gano oil affected, apply at the affected area daily and massage gently. Okay, so when you keep on do that, and also we follow up with the more in the hospitals and see what they can combine together and go through it. And don't stop this. Even though you take a chemo medicine, it won't harm with this microwave with these solutions, because all this solution is not a medicine at all. It's a food that alkaline your body, and it will help the chemo medicine or whatever they're giving to you. Okay, it will supplement the modern medication together, and recovery process will be faster, and chances of developing or metastasis to other area will be minimized as much as possible. This is how we can see quite number of patients that combine together. Okay. And if you see symptom of breast cancer, you must remember all these symptoms must be seen every day, check and monitor. Okay, don't come back at the late stage and tell it's too late already. So when you see every day, when you check yourself, the first things you need to check is the nipple turning inward. The first photo, nipple turning inward. If you see the nipple start to turning inward, then we need to start to analyze something is going wrong. The second thing, nipple discharge. Okay. The third thing is lump in the underarm area where the nodule or what you call lymph node start to be swollen. There's something goes wrong to the lymph node area. Then later can go towards they can bring downward towards the breast area. The fourth one is swelling of the part of the breast. So you can see some part of the breast is slightly swelling outwards, swelling outwards. Then this is something need to be monitored. The fifth one, swelling of all the breasts. Both breasts are very swelled and very tender. Okay, very hardened, and you need to monitor on that. And skin dimpling. See, some of the part is dimpling. This all need to be monitored. The next one, breast or nipple pain. They will feel very pain on the breast area or the nipple area, like a poking pain that coming out, or very highly heat pain. Okay, they will see very hot in that area, like very heat. Okay, so this is need to be taken care. Okay, and some of the part of the breast area, there's a skin irritation started. Okay, irritation, they're like very swollen or black color or red color, or it's always irritate that something is go wrong in that area. So these are the things that you need to monitor. Okay, you have to examine yourself. Okay, this is not small things in the long run. You need to monitor maybe every week or 2 weeks once. You just monitor. In case of anything, something goes wrong, then you can go and see the subject matter expert. Then at least they can advise you what to do the next step before it's too late. Okay, before it's too late. Okay. Okay, so start your days with a healthy way of DXN. Thank you.
Doc?
Okay.
I think one of our members, Audrey Law, has posted some questions in the chat group, but I think I let her talk to you. I encourage her to open her mic and ask you all the questions. Audrey, Please ask Dr. Siva what you need to ask.
Hi, Dr. Siva.
Hi, Audrey. Yes.
Yeah, so about 2 weeks ago, I think I sent you a WhatsApp about my condition. On
WhatsApp me?
Yeah.
Okay. I also forgot too many WhatsApp. Okay.
That's okay. So
yeah.
maybe I just refresh memory again.
Okay.
So on the 25th of November, I went to do an ultrasound breast because the day before, while I was just feeding my breast, and then I suddenly felt like something sticky coming out from my breast. So I thought what happened, and then I saw like a brown liquid coming out from my right breast.
Okay.
Yeah, and then but I think, if not mistaken, a week before that, I felt a very sharp pain on the nipple area, but I didn't think too much about it. Only when I saw the liquid come out, then I went the 2 days after that to do ultrasound. So I went to Timberland, and then after that, the doctor was saying I think what is it called, the memory duct.
Memory duct. Okay.
Yeah, is
blocked.
I don't know whether to call it blocked or what, but it's like there's one part of the memory duct is like infected or something.
Just now I go through the slides on this part. Okay.
Yeah.
So if the memory duct block, okay, this normally how old are you now?
38.
Okay, 38. So you are near going to menopause category, near going towards the menopause category. So when the memory duct blocked, the first thing you can see something liquid come out from the nipple. Okay, this liquid is like sometimes very sticky, like very creamy, very creamy, very sticky. Okay, sometimes brown color, sometimes yellow color. Okay, these are the things will come out. Okay, means that some of the part of the duct has been blocked. Okay, you married?
No children, not breastfeeding, not anything.
Okay. Sometimes it happen due to the premenopausal category symptoms. Okay, sometimes nowadays maybe some people have a fast menopause, early menopause. So your period every time is okay, or stuck like that?
So far okay. No, it doesn't come like on time, but I think the cycle is still okay lah. Sometimes
Okay. In your case, there might be two things. One can be some infection going on. Okay. Or the second one can be a memory duct blockage. Okay. Either infection or memory duct blockage. Okay, so when you press it, did the what do you call, the discharge has been coming out every day?
Coming out every day, I'm not sure, but if I wear like a lighter bra, then it will come out, so I can see that there's.
Okay, so what you do, you use the Gano oil, massage gently. You just push it. Just push the things to come out. Okay, then you apply Gano oil with the RG powder. You apply surrounding it, and don't wear the compressed bra or anything. Leave it as relax. Okay, and do a hot towel compress. Hot towel 3 times daily is better. So you just hot towel, the hot water. You just put salt a little bit. Then you put a towel inside. Then just soak it, the towel, and put for a while. So this will help the blood flow in the surrounding area of the ductal area. So when the blood flow of the ductal area improving, so lot of ductal, the small like a liquid will start to release. So you need to monitor until all the things are released. Is there any inflammations going on in that area?
No,
No inflammation, no inflammation, no nipple inflammation, no breast inflammation. So that means it's nothing to be worried for time being, okay? Any dimpling out or change of structure?
So far, I don't think so.
Okay, that means it's nothing to worry. It's just mild memory duct blockage. So I tell you, it's two things: either infections, okay, or memory duct blockage. So for both, okay, for both, you can take the first step I teach you. You take the micro-veg, Roselle, all these things. Okay, you can take that solutions. Okay, you can take that solution. And also apply the Gano oil every day, massage gently, just push it, massage gently, then push out whatever the discharge coming out. When you start to discharge coming out, is good because the duct is keep on cleaning. When you push it out, the duct become clean. Okay, and monitor for 1 week whether the discharge is keep on reducing or keep on increasing. And also you need to monitor whether inflammation occurred in the area or not. If no inflammation, the discharge keep on reducing, and that means you are improving. So you don't need to worry about it. Okay, don't worry about it. Is the doctor give you any antibiotics, anything?
Yeah, he gave me a 1 week antibiotics.
Okay, so take together with Richelium, Androgy, Gano oil, massage, and also the Roselle powder, everything as I teach you, you take together, then you monitor and update me. Okay?
Okay.
Nothing serious. Your one is nothing serious, so no need to worry. Okay, nothing
actually,
serious. Don't confuse yourself. Okay, it's a very mild category.
Okay.
I think it's something infection going on because sometimes that's why you see sometimes they put the bra very stiff, very compressed bra. All these things can make the blood flow to stop. So when the blood flow stops, and the infection can affect it.
Oh, okay.
Okay, so it will bring down the circulatory. So that's why those time you see wearing a cotton bra is the best. Okay, nowadays there's a lot of people are using a PVC polyester kind of breast a bra. So the polyester bra actually not very good, and also wired bra is not good at all. The best is go and find the cotton base without a wire. Okay, without a wire. That is the best for current time being. Okay, for current timing, that is the best. Okay, so you change the bra type also. So I always encourage a lot of women that come. Some patients come and see me. I tell them first change. Don't use the polyester type because polyester type can stop the blood flow to that area. Okay, because it's like magnetic field. Okay, so you will have a imbalance of the blood flow in the breast area. By wearing a cotton that is more natural and more better, it will enhance. Cotton will enhance the blood flow. Polyester never enhance the blood flow. It will block the blood flow. So that's why it's very. Then someone wearing a tight bra is not recommended at all. Okay, night time, sleeping time, better be very free. Don't compress with the bra and sleep. That will also can cause a lot of inflammations and blood flow problem in the area. Okay, the lymph node also sometimes can swollen because of the tight bra they're wearing. Night time they sleep with the tight kind of this one. Okay, so you change a bit, then follow what I teach you. Maybe just monitor and update me lah. Okay, then we see what we can do the next step.
All right.
Okay.
Actually, about a week plus, I've been taking those that you recommend.
Okay.
You recommend, except for micro-veggie, I think.
Yeah, micro-veggie you need to give because you need to cleanse the colon because any infection, anything started from the colon side. So that's why the micro-veggie is very important to clean the colon area. To make sure the toxins is out from the body.
Okay. I hope it's okay because I've been applying Gano oil in the morning before I go to work, but then halfway working I don't apply like
but use a hot towel practice.
Is this warm pack,
warm cloth.
cold warm pack, that one is okay?
Better you use the water lah. Better lah. Hot towel lah. Hot towel. They call it hot towel lah. The hot towel is good because hot towel will enhance the circulation.
Oh, okay.
Hot towel will enhance the circulation, so that will improve your blood flow in that area. Then after that, then only apply the Gano oil.
So at night also I mix this RG powder with the Gano oil and
yes,
just
before you apply that, you give a hot towel, warm pressure, hot towel pressure. Okay, then after that you apply the Gano oil with RG mixer.
Then the hot towel probably about how long? 15
maybe
minutes?
10 minutes. You just give 10 minutes. After that, you apply the Gano oil.
Okay.
Okay.
All right.
Okay, good, good.
Thank you so much.
Okay, thank you. Okay, I saw another question here. Dok, kalau orang ada GERD and anxiety, ada supplement perlu mereka ambil. Okay, GERD is actually more to the colon category. Anxiety is more to attitude category. Okay, so anxiety means you tak cukup tidur. So get a good sleep lah. Okay, the best is take Androgy 2 morning 2 night. Okay, and for GERD, all these things you take Myco-AG, Morinzyme, Lion's Mane. Then you can see the what you call the GERD will disappear. For anxiety, you take the Androgy will help you lah. Okay. So and Sinan asked me. Okay, Sinan. Okay, Sinan. Okay. Now, any other questions?
Any more question? Dr. Siva is online.
Oh yeah, another question.
Yeah.
There is actually 2 cysts on my left breast also. So I'll just do the same thing.
Correct, correct. Do the same thing. Do the same thing. As I teach you, the slides that I will post I will upload the today's event in the YouTube. You can go through it and you can record it down lah. So just do whatever we prescribe and you just follow up lah accordingly lah. Okay.
All right. Thank you.
All right. Okay. Good. Okay. Good. So 9 plus ready. If any questions, anything, we will end up the session today.
Yeah.
Okay, Selena?
Yes, Doc.
Is it okay?
Yeah, thank you, Doc. Good.
Yeah,
Excellent.
If no questions, anything, let me close the thing.
There's one more question in the chat
From
box.
Harinda Kaur.
Huh?
One more question in the chat box, Doc.
I have GERD for many years. I was on Nexium for many years. Now I'm taking your product. Okay, lah. So what I want to answer? There's no other question. Okay. Okay, taking the products, just follow up. Then we will monitor accordingly, lah. See how is the things going on, and see how is it, Herinda. After taking the things, how you feel now? Is it much better, or how is it? Hi, Herinda. No answer. Never mind. We will follow up me in maybe a separate channel, and then we can communicate lah. Okay. So GERD is same thing. It's like you're eating on the wrong time, not fully recovered. Yeah, it takes some time because you are too long with Nexium. Because when you're too long in Nexium, your overall colon mucus layer has been dissolved. Okay, so you need to create back all this mucus layer back to normal condition. It takes some time. So follow up accordingly. Then slowly we will balance it back lah. Okay. Okay. If not much question, I think we can end up the session today. And then let me off the video.